Welcome to the training session on weekly COVID-19 vaccination data reporting for dialysis facilities. My name is Elizabeth Kalisle, and I work with the Division of Healthcare Quality Promotion at CDC. There are 3 objectives for today's webinar. The first objective is to review frequently asked questions about data reporting. Next, we'll go over data entry topics, as well as tips facilities can use when navigating the NHSN application. At the end of the presentation, we'll review resources on COVID-19 vaccination data reporting that should be helpful to facilities. Please note that today's slides have been put together by various members of the NHSN vaccination unit. First, let's start with going over some general questions. The first question is, for hospital-based programs, do healthcare personnel need to be reported in both the hospital and dialysis facility data? If healthcare personnel were eligible to have worked in the hospital and dialysis facility, each facility should include the personnel in their data. Another question is, how should I report data for patients with chronic or acute conditions? Facilities should include all patients who receive dialysis care from the facility during the week, including those having chronic or acute conditions. We recognize that there is fluctuation within the patient population in dialysis facilities. And facilities have asked, when reporting the number of patients receiving dialysis care from the facility during the current reporting week, do we include patients that were discharged or expired? If the patient received care in the facility for at least 1 day during the reporting week, they should be counted in question 1 on the data collection form for the current week. However, the patients would not be included in the data for subsequent weeks. Patients sometimes receive dialysis treatment during hospitalization by another facility. Facilities should include patients treated by the outpatient dialysis facility at least 1 day during the reporting week. If a patient only received dialysis care during a hospitalization, you should not report data for that patient. However, if a patient was hospitalized during the week and was also treated by your dialysis facility at least 1 day during the reporting week, then you should report data for that patient. Facilities have also asked how to report data if none of the patients at the facility received an initial COVID-19 vaccine series. If no patients received an initial COVID-19 vaccine series at the facility or elsewhere, please enter 0 for question 2 on the data collection form. Please note that facilities still must complete question 1 and enter the total number of patients receiving dialysis care from the facility and provide answers to all other required fields. And these are indicated by an asterisk to save the data. This slide covers who is considered eligible for an additional dose or booster of the COVID-19 vaccine, according to the latest CDC guidelines released this month. Facilities should refer to the CDC guidance to determine individuals eligible to receive additional doses or boosters after receiving an initial completed vaccination series. Those eligible to receive an additional dose or booster vary by factors including vaccine type, age, location of residence, underlying conditions, and occupation. We've received several questions about the SAMS process, such as obtaining SAMS card or reactivating a card. Guidance about the SAMS process can be found using the link on the slide. So now let's move into the second part of the presentation on data entry. However, before we continue with our review of vaccination data, I will turn things over to my colleague, Austin Woods, who will be going over a few points about COVID-19 testing data.
Hi, this is Austin Woods, and I'm going to do a brief overview of this slide of a new business rule that has been implemented as of the release at the end of October. So any facility that reported this week, so Tuesday night or Wednesday, they were subject to this business rule. And this is the fact that the number of newly confirmed patients, which is the sum of newly confirmed in-center patients and newly confirmed home patients, this sum must be equal to the number of reported positive tests. And keeping that in mind, there's another business rule that the number of positive tests, there has to be a vaccination status for each of those. So if a facility has 2 newly confirmed COVID patients, they are to report 2 positive tests, regardless if the test was performed in their healthcare environment, and they are subsequently to give and provide the vaccination status of those 2 newly confirmed patients. This is so that we can know the vaccination status of all newly confirmed patients. And that is all. I'll turn it back over to Elizabeth.
Great. Thank you, Austin. So in terms of entering COVID-19 vaccination data, there are 2 main ways facilities can enter these data. The first is to manually enter data into the NHSN application using the data collection form. The second way is to upload data through CSV files. For information about CSV upload, please review the guidance using the link provided on the slide. We'll now review some tips for data entry, focusing on the data collection form. Some facilities have received the error that the sum of individuals reported for questions 2 and 3 must be equal to the number of individuals reported for question 1. This error is generated when data are entered for questions 2 and 3 that are greater than or less than the total number of individuals reported in question 1. Specifically, the sum of individuals reported in question 2, which is questions 2.1 to 2.99, and question 3, 3.1 to 3.3, must equal the total number of individuals reported for question 1. It is important to manually sum the values entered for all fields in questions 2.1 to 2.99. The any completed COVID-19 vaccine series total that is auto-calculated by NHSN for question 2 only includes individuals who received a complete vaccine series. Since this does not count individuals with partial vaccination, relying on this total will likely result in an error. In this example, the user totaled the numbers in question 2, 2.1 to 2.99, and 3.1 to 3.3, and can see that the numbers equal the total number reported in question 1. For this slide, the user should remember to include the data entered for individuals receiving only 1 dose of the vaccine to ensure that the data entered for question 2 and 3 equal the number of individuals listed in question 1. A user will receive this error when the number of individuals reported in question 4 as being eligible to receive a booster or additional dose is greater than the total number of individuals reported as receiving a complete vaccine series. The total number of individuals reported in question 4 as eligible to receive COVID-19 vaccine cannot exceed the total number of individuals reported in question 2 as having received a complete vaccine series. This is consistent with eligibility requirements per the CDC interim clinical considerations. An individual who has received a complete vaccine series has received dose 1 and 2 of the Pfizer or Moderna vaccines, a single dose of the Janssen vaccine, or received a complete unspecified manufacturer vaccine. This is auto-calculated in the NHSN system and displayed as any completed COVID-19 vaccine series. So in this example, an error is not generated since the numbers entered for question 4 do not exceed numbers entered in question 2. A user will receive this error when the total number of individuals reported in question 5 as having received an additional dose or booster is greater than the number of individuals reported in question 4 as being eligible to receive the booster. Please note that the total number of dialysis patients reported in question 5 as having received an additional dose or booster must be less than or equal to the total number of dialysis patients reported in question 4 as being eligible to receive an additional dose or booster. Since question 4 and question 5 are required fields, a value must be entered for each of these questions for the form to be saved successfully. If no individuals have received a booster or additional dose of the vaccine, a 0 may be entered for question number 5 to save the form. In this example, an error is not generated since the numbers entered for question 5 do not exceed the numbers entered in question 4. Users should report all COVID-19 vaccination by manufacturer type. The NHSN application allows for vaccines by multiple vaccine manufacturers to be reported in a single data collection form. To enter data for more than one vaccine manufacturer, first you would select a COVID-19 vaccine from the drop-down box. Next, enter the cumulative number of individuals who received only dose 1 of the vaccine. After this, enter the cumulative number of individuals who received both dose 1 and 2 of the vaccine. If some individuals received another type of vaccine, then return to the drop-down box and select the other vaccine, and then repeat steps 1 to 3 as described above. Facilities can review their data that have been saved in several ways. Saved data can be viewed by navigating to the calendar view on the vaccination summary data page. Records that are displayed in green are complete. Data that have not been entered into the NHSN application do not display the green record. Facilities can select any of the green records to view their data or edit them. Records that have been previously saved will display a date created, which indicates the date the record was first created and saved in the application. The date last modified field refers to the most recent date edits have been made to the data in the data collection form. Line list data reports can also be downloaded using the NHSN analysis and reporting function. To download data line lists, please navigate to the Analysis tab from the left-hand navigation bar. Facilities will need to generate data sets prior to running a line list report to ensure that the reports include the most up-to-date data. To do so, select Generate Data Sets, then Generate Reporting Data Sets. Next, navigate to Analysis and Reports. You will then be able to generate different line listing reports under the COVID-19 Vaccination Data folder. After running a report, you can also see an HTML report with a line list of the data displayed on your screen. For more information about creating and modifying line list reports for COVID-19 vaccination data, please refer to the quick reference guide linked on the slide. NHSN regularly reviews data reported through the Weekly COVID-19 Vaccination Modules to understand trends and to identify potential reporting errors. Data that may have been entered in error are flagged by the NHSN application and displayed as a data quality alert on the application landing page. Users will see these alerts when logging into the dialysis component or can access the alerts by selecting Alerts from the component menu on the left-hand navigation bar. A table with information about the QA alerts will be displayed, including the reporting week, which form the alert is referring to, and descriptive information about the QA flag that has been generated. By selecting the pink QA alert icon, users will be redirected to the data collection form to review and edit their data accordingly. A current data quality alert in the NHSN application generates if vaccination rates for a reporting week are less than or equal to 10%. And this is for a reporting week starting with March 2nd. This is calculated as the number of patients who have received any partial or complete COVID-19 vaccination series divided by the number of staff in the facility for that week. Please note this excludes those not eligible to receive the vaccine due to medical contraindications. For more information about how to view and clear data quality alerts, please review the following resource listed on the slide. Please note that there was a recent defect associated with this alert. However, it's been resolved. The next few slides will outline some resources that may be helpful to you. Please use the link on the slide to access the COVID-19 modules and dashboards from the NHSN homepage. The Dialysis component website contains links to a variety of training materials. The link on the slide will take you directly to these resources. You will also see a tab on the webpage to access frequently asked questions. CDC has created a tables of instructions document that provides definitions for all categories and questions on the data collection form. Facilities should review all instructions before collecting and entering COVID-19 vaccination data into NHSN. If you have any questions about NHSN, please send an email to usersupport@nhsn@cdc.gov. Please include weekly COVID-19 vaccination in the subject line of your email, along with your facility type. This concludes the presentation. Thank you so much for your time.